You may have heard that Medicaid coverage will end for as many as 8 million Americans in the coming months, and it will push many into unfamiliar territory, and that's the health insurance marketplace. The reason? States will start cutting people from the government-funded plans when they no longer qualify based on income, a process that has been paused since shortly after the COVID pandemic hit. Next steps if you're kicked out of Medicaid, from Paul Seegert, managing partner at PCS Advisors, a health benefits consulting firm. Paul set this up.
Yeah, as part of the Inflation Reduction Act and other COVID rescue legislation, we extended extra funding to states to allow people to stay on Medicaid so long as, or enroll in Medicaid. And one of the conditions that we placed on those states was that they could not audit the enrollment. So they couldn't check to see if people actually qualify based on income and other requirements periodically, which they normally would do. And so we've kind of artificially increased the number of people on Medicaid, on the Medicaid program, and which has gotten us to a place where we have a record low number of uninsured Americans. But we also have put a bunch of people onto a program that they maybe don't, not maybe, they don't qualify for.
Right.
And depending on who you believe, it's as many as 8 million. I've seen estimates that are actually significantly higher than that in terms of the numbers of people that are on Medicaid that don't qualify, that will be disenrolled as soon as the states start to audit enrollment, which they'll do as the COVID emergency lapses and they stop getting extra funding.
Okay, so millions will be off the Medicaid rolls and on their own. What do you recommend here, kind of as step one, maybe step two, for folks who are going to need health insurance?
Well, a lot of them came from other coverage. So we created some moral hazard where we pulled people from coverage maybe that they were paying for or paying for in part on their own onto these government programs. So many of them will return to coverage at work, and then many, the balance will go back to the marketplace to purchase coverage. And this will become a qualifying event for them, and they'll need to go to the exchange if their state has an exchange, or to the marketplace nationally otherwise, and purchase coverage. And many of them will still qualify for some subsidy when they do that. It just won't be Medicaid where it's all essentially covered.
Okay. Will that be confusing for folks?
Oh, I would say so. Health insurance is confusing for me, and I'm in the business. So yeah, there will be confusion. It's one thing we're good at around this whole payment model, is creating confusion.
So how do you get help, though? I mean, if you're confused by it all and frustrated, sometimes you want to slam your laptop shut and think, how am I supposed to figure this out? Then what do you do?
Yeah, there are resources for you, so you can get with a local agent. They'll help you selecting the right plan, because I think the risk you face is that you select a plan that looks affordable in terms of premium, and then you find out you have a bunch of unexpected out-of-pocket costs. So it really is a good idea to talk to someone, an agent, and you'll be able to find them in your area, even through that exchange. When you go to the exchange, look around. There'll be people that will reach out to you as a result, or you can find them online.
We're speaking with Paul Seegert, managing partner with PCS Advisors, and we're talking about shopping for health insurance as Medicaid ends coverage for millions. So you reach out to an agent, and he or she is working on your behalf, I presume, but do they have access to every health insurance program that might be out there, or only a select few that they peddle?
Yeah, you want to find someone who will work with you on every plan that's available in your county. It's basically county based. So if you reach out to the agent that handles your home and auto, are they going to be someone that has access to all those? That's a good question for you to ask. Some of them have an alliance with maybe just one or two companies, which of course gives them an incentive to recommend those companies, even if they may not be the best fit for you. So I think that's a very important question as a consumer to ask.
And so some of these income restrictions, right, people are not going to qualify for Medicaid anymore. That's done by state or by county, perhaps, as you just referenced. How is that done? Yeah,
it's going to be at the state level that the Medicaid enrollment rolls start to get audited again. And that'll vary state by state how quickly they jump on that. I mean, it's going to be a huge project to unwind when you have maybe inflated those rolls by anywhere between 8 and 15 million people.
Nice, Paul. Paul Seegert, managing partner at PCS